We'll also have some pause as we go along. So those will pop up on your screen. I will remind you to take the poll and click the appropriate button as we go. And at the end of our webinar, we are going to have a post-event survey, which will take you just about 2 to 5 minutes. So we will appreciate really hearing from you, just a quick feedback on how the webinar has gone, how we could do this better. We have a second webinar coming, so your feedback will be very highly appreciated. Yeah, so thank you very much. Our agenda for today, we have done the welcome and introduction. That's my job, which I hope I'm doing okay so far. If not, if there's still questions lingering on the logistics, put them in the Q&A and we can address those. We will go straight into sort of looking at the overview of the SusWASH program, which I hope you're all excited to hear about. And as we go, we will have opportunity to address your questions and comments that will be in the chat. So I think we should make the best use of our time and jump straight into introducing our panelists so that we can hear about all their exciting work. We have Segareda Abraham from Ethiopia. So she'll be speaking to us about the Ethiopia program contribution to the SusWASH. We have Sahel, he's from Pakistan. We have Caesar from Uganda, and Sokong from Cambodia, and Hannah, who is our Sustainable WASH advisor and is based in the UK and has been engaging with all of the countries in which this work has been done and offers some really good overview of the intentions of the work, what we've been able to achieve so far, and how we have ended up where we are. And Maria from the H&M Foundation, which has generously supported the work of SusWASH, will be joining us a little later on, but she will also offer her own reflections in terms of how H&M sees the outcomes of the work so far, why they have supported this work, and what they think others should be doing in supporting similar work. Okay, so at this point, oh, and I'm Chilufia, sorry. I'm Chilufia Chileshe, and I work in our global policy team. And I'm very delighted to be with you this morning. Okay, so I will invite Hannah straight away to give us a background to the WASH system strengthening and the SusWASH program. So Hannah, you have the floor.
Thank you, Chilufia. Great, and thanks everyone for joining. As Chilufia says, I'm Sustainable WASH Advisor based in the London office of WaterAid. I'm also the Global Learning Lead for the SusWASH programme. And I will just spend the next few minutes taking you through a background to the SusWASH programme, how we've been designing the programme, measuring change, adapting and learning, and then we'll go into a panel discussion where you'll hear much more about the concrete examples of what we've been doing in each country programme, lessons learned, challenges. So this won't take too long. Just move this slide. Great. So as Chilufia has just outlined, the SusWASH programme is a 5-year initiative funded by the H&M Foundation, which aims to tackle the systemic barriers to WASH sustainability, inclusion and scalability in Cambodia, Ethiopia, Uganda and Pakistan. Each country project looks different depending on the context and the analysis of that context that we did at the start. But there's a global learning component that facilitates cross-learning exchange and global advocacy. So where did the SusWASH programme come from? Well, as we all know, many of us know in the WASH sector, there are persistent challenges that we face in the work that we're doing. And these include poor wash sustainability that has been known about for many, many years, that we're not seeing the results that we expect to see. There's also persistent challenges of social exclusion and marginalisation, meaning that most marginalised people are still left out when it comes to having access and good quality wash services. We're not reaching the scale that we hope to see through the methods of delivery that we're employing. And there's insufficient prioritization of learning and course correction or adaptation as we go. So there's growing interest in system strengthening and applying a whole systems approach to addressing these 4 interlinked barriers. So what do we mean by the WASH system? And many of this won't be new to you all on the call. This is similar framing as many other organisations. But for us, our aim is really WASH services for the most marginalised people. That is the core of what we're aiming to achieve. But for WASH services and behaviours to last and reach everyone, there are a number of actors involved in the delivery of inclusive and sustainable WASH. And some of these are listed on the screen in front of us, such as local government, other NGOs, regulators, service providers. There are a number of other factors such as finance, accountability, institutional arrangements, coordination mechanisms that also play a role in the delivery of that of WASH to everybody, and they all have a role to play. And between these actors and factors are power dynamics and relationships that affect whether or not those WASH services reach those people and last. And you can see these illustrated with the connections here. But within that system, there are various barriers and blockages, and these could include things like inadequate or untimely finance, politics and power dynamics, structural inequalities that prevent WASH from being sustainable and inclusive and achieving WASH at scale. So really within the SusWASH programme, we're working to unblock these barriers within the WASH system that affect the realisation of water and sanitation rights for everyone. And within that system, this is from the perspective of WaterAid, there is a level of influence that we might have within that system to bring about that change. And you can see that demonstrated here with the blue haze. So really we've been working at multiple levels within the SusWASH programme, from local government level, which you can see at the bottom of this diagram here, identifying what barriers might exist within that WASH system that I just described, at higher levels, at provincial or national levels, working at those higher levels to unblock some of those barriers, and also working at a global level to facilitate learning exchange and course correction. So as we can see, the WASH system is very complex, and we often, when we're doing this work, come across unforeseen challenges that require us to stop and pause and reflect and think about whether what our pathway is to achieving the outcomes that we've set ourselves. So this is just a small diagram to explain the cycle of learning and adaptation that we've used within the programme, where we've stopped to share lessons learned and progress and adapt our plans as we go, as the context changes and challenges might arise. We also, in the SusWASH programme, work to break down the complexity of the WASH system using building blocks, and you can see these on the screen here. Many other WASH agencies, such as WSUP and IRC WASH and Agenda for Change, have their own building blocks, and these are just WaterAid's building blocks here. These are obviously all interlinked and overlap, and there are power dynamics and interrelationships between the people working within the system. And obviously this doesn't capture it, but it seeks to condense that complexity down into a way that can be used to design the SusWASH program and other system strengthening programs, and it should be complemented by other analysis such as political economy analysis, stakeholder mapping, and power analysis. We use a building block framing to develop an evolving measurement framework, which takes the building blocks. We can contextualize them for each context and track progress against those building blocks, but also any challenges that might arise throughout the work that we're doing. And it helps us to learn how change is being brought about, what we might need to do differently. So some achievements to date, just very briefly, we've reached over 190,000 people with access to water and/or sanitation. And this is either directly through the demonstration of and delivery of WASH services, but also indirectly as a result of our efforts to strengthen government planning, monitoring, budgeting processes, for example, and coordination and clarifying roles and responsibilities. And these are listed on the slide here, and much more is detailed in the learning report. So we wanted to take some time now. I think, well, that was the end of my presentation, but I think it would be good just to get a sense from people on the call what your understanding of the WASH system is, and how, whether or not what I've just presented matches yours. So we just have a quick poll, and then I can hand back to Lufia. I just launched the poll now. This is a quick question just to understand whether the WASH framing that I presented is similar, how it compares to yours or not. So hopefully you can see this on your slide now. You can see people voting. That's great. Excellent. You can see 38 people have voted already. Great, okay. So I'll just end that poll now. And you can see the results. Great. So we can see that 57% of people have a very similar understanding or framing of the WASH system. For 40% of people, it's the same, and for 2%, it's very different. So that will be very interesting to hear more. Unfortunately, we can't right now, but it's good to see that people on the call have a similar or the same understanding as what we've just shared. So I'll pass back to Lufia now. Thank you.
Great, thank you, Hannah. We couldn't see the result of the poll though, so thank.
Let me share them now.
At them out, but
hopefully you can see them now.
Okay, yes, now we can. No, I can see them. I hope everyone else can. Okay, great. Thank you very much, Hannah. I think that was a really good, clear, and quick summary of what has been happening in what is quite a complex multi-country program happening over a few years. So thanks for that, showing us the work strengthening systems at various levels of governance, national and subnational, how we are working using those various building blocks to try and break down the complexity and make it easy for us to analyze how we are doing on various aspects, whether it's planning or financing for WASH. But more importantly, this whole idea of adaptive management, how we make sure that we are course correcting as we go, and making sure that we understand where changes need to happen and what lessons we learn for the future, which is all incredibly important for making sure we can get access to water for all, and sanitation and hygiene. All right, so I promise you all that this will be the last PowerPoint you see, because now we are going to try and have a very interactive discussion with people that have been involved in the program from the various countries, just to hear from them, how does it look like firsthand? What kinds of things are they proud of? What challenges have they faced? What lessons do they have to share with us as we all continue to expand our understanding of system strengthening and how much more we can do? So I will start with Caesar. Are you there, Caesar? Good morning.
A very good morning, Chief. Caesar here. Allow me not to share my video. I'm struggling a bit with the internet connection here. So I'm trying to make use of my bandwidth.
Okay.
Yeah, so Caesar Chimbugwe is my name. I manage the SusWASH program in Uganda.
Great, thank you,
Can you hear me okay?
Yes, hear you loud and clear. Great.
Okay.
So, Caesar, in Uganda, you have focused a lot on getting political buy-in from city mayors on WASH. Can you tell us, what your experience has been working with the WASH Mayors Forum? Has it been worth it for you? And what highlights would you like to share out of that work?
Yeah, thank you very much, Chief. In Uganda, we've worked with the local authority, that is Kampala Capital City Authority, to form a mayor's forum on WASH. Now, previously, there's been different political platforms that have been formed. One of them that has been prioritized for political buy-in and support. And we've previously also had challenges within the city leadership, whereby the political and the technical wings that are supposed to work together to deliver sustainable services, in many cases do not work together. So we felt we needed to establish a platform where politicians feel they're part and parcel of the development plans and also the delivery of those plans, and then make them in terms of delivering those services. So we've been able to mobilize them, and they're able to do joint planning, but also cross-learning from each other. So that is for Kampala within the divisions, or call them municipalities making up Kampala city, but also the surrounding peri-urban municipalities. Because the challenges of urban authorities transboundary, they transit beyond the administrative units of those areas. So you need to bring together the peri-urban authorities and do joint planning, issues of fecal sludge management, solid waste management. You find that most of the people working in Kampala during daytime are not the people who reside in the city. So the city planning of about 1.5 million people becomes overwhelmed during daytime. Public sanitation facilities are overwhelmed, solid waste management. And so you need to find a way of bringing together everyone on board to plan and also learn. But it's been challenging also, especially during the political season. We are into campaigns for both the presidential and also members of parliament and all other positions of leadership. So getting political leaders on side and also making sure that you do not politicize these issues and you remain on course without being seen to be either maybe supporting a certain political wing, that can be challenging in these kinds of times. And that is one of the things we've been trying to see how we balance it and be non-partisan as possible and remain on course. Thank you very much.
Great, thank you, Caesar. I think we'll come back to you on this whole, on your experience working with government and those government partnerships more generally. And I should have been clear at the beginning to ask my panelists to try and not speak more than two minutes in response to the question, because we would like to get to the participants' questions as well. So The Mayor's Forum, Caesar, if I just follow up half a minute, can you tell us a little bit about that? Just how is it constituted, who is in it, and how is it working?
So I'll use less than 2 minutes this time. The Mayors Forum is composed of mayors from Kampala. Kampala has 5 divisions, and each division has a mayor. But then we also have the mayors and also mayors from the peri-urban municipalities that surround Kampala. Those are 3 of them for now, but we are bringing on board other mayors.
Great, thank you very much.
From the rest of the peri-urban authorities.
Thank you. So, Sahel, I don't know whether you're with us from Pakistan.
Yes, I'm with you, Shilufia.
Great. Are you able to switch on your camera? I can't see you yet.
I think it may not be possible because of the bandwidth, so probably
No problem.
I'll use the mic only.
No problem. This is the life of Zoom. We have to always have discussions about bandwidth. Okay. So in Pakistan, you were working with the provincial public health engineering and education departments, but also the district WASH forum. So can you tell us a little bit about what challenges you experienced working with government at these various levels and how you overcame them?
Thank you, Shilufia, and good morning, everybody. Yeah, I think, traditionally, like there is a lot of, the foremost, I would say, challenge is that government never trusts an ING or a civil society. So there's a kind of mistrust, and unless you prove your worth and value to the government and bring in a value addition, there is very little space for civil society to work closely with the government. So that I think is the foremost challenge. Then when you go into like working with the government, they have very bureaucratic and traditional way of working. So setting deadlines or meeting, putting timeline to something which you are working very closely with the government is very hard and challenging. I can quote you an example, like we were to sign an MOU with the education department, and it took us 5 months to go through that process before starting anything on ground. So that's another challenge. And like over a period of time, this COVID also had some limitation on some of the activities because there was embargo on public meetings. So we had to kind of restrict ourselves to distant meetings and use different ways of working. So I think in summary, if I could say, like you need to bring in something which they bring in, like while we were working with public health engineering department, we supported them in developing WASH asset mapping for one district. And we also kind of talked to them about this life cycle costing analysis. So they found that this is very relevant to their work. So kind of matching your plans with their plan is something which wins you confidence of the government, and you can work very easily with the government. Again, within education department, we were able to identify a champion. She was very kind of willing to do something for girls' education, and when the things we were doing under the project very much matched to their planning. So she helped us in integrating our menstrual hygiene management into their teacher training manuals. Similarly, she was very pivotal in improving the school WASH monitoring system. So I think that's the way. If you identify a right level of champion or a like-minded person within government, that makes your works little easier. And again, like identifying common areas of interest where you have win-win situation for yourself as well as for the government, and kind of building flexibility within your plan. Like you can't fix deadlines within your working with the government. So you have to kind of work to their convenience and see. So things we planned for the first year within our project, we had to, in certain cases, we have to take some of the activities to second and third year to see when they can give us time. So there are like quite a few things which you have to work around to win confidence of the government and work very closely with them. Thank you very much.
Great. Yeah. No, that's really interesting. I think your points about getting champions and supporting with costed plans and so on sounds really like very important work. But often we find that financing those plans is quite problematic, and because of the challenges with WASH financing overall. So if I turn to you, Tegoreda, from Ethiopia, thinking about this challenge around financing WASH, even when you have good plans, what do you think, what are some of the ways that you have tried to attract investment in the district? Is there more that you think needs to be done to get greater investment for WASH from your experience in Ethiopia on this program?
Thank you, Julufia. From the Ethiopian perspective, what we have done initially was a life cost assessment. So for the district, we have helped the district look at their capital cost to reach universal access, but also minor maintenance, major maintenance, and even in terms of staffing, support cost, monitoring cost. But that didn't necessarily result in increased financing. There is some level of increase, but there's still a gap. So what we think should be done is, and we have seen a gap in terms of fiscal decentralization. So the zonal and the regional level hold some major maintenance funding that they don't deliver to the district level because the district doesn't have the capacity. So that initially, this is the advocacy area that should be prioritized. More decentralization will require, of course, a better capacity at the district level to be able to develop projects and also design water supply projects and deliver them. So WaterAid with this program has worked on building that capacity. And another area is the WASH investment plan was developed for the district. So the WASH investment plan needs to be costed, is costed, but needs to be funded. So funding, the districts need to be supported to develop a funding strategy and market their plan, their WASH investment plan. So this is also an area of focus. And another way of bridging the gap in financing is cross-financing, especially community financing. There are many opportunities. People are happy to pay for household connections, for instance. There's a lot of investment that can come from private sector. We still need to tap into these areas. And there's also a need to look for microfinancing opportunities where there is joint financing access to pay and get a service in advance. So these are the areas I think should be given emphasis, in addition to having a well-developed WASH plan and a well-costed WASH plan in future, looking at other opportunities for funding other than government funding, of course. Thank you.
Mm-hmm. Great, thank you. So I think that's an interesting point that you raised, this idea of district investment plans that are well costed and that are, I assume, developed collaboratively with government and several other stakeholders. But then I wonder, how can we make sure that we leverage investment from other actors in the WASH sector beyond what government can deliver? So I'm going to just turn to Sokang from Cambodia and tell us about what strategies you have used to leverage investment from other actors in Cambodia.
And yes, thank you, Chaluja, and also good morning, everyone. And Yes, it is the good question. So I think the war financing is not just only in Cambodia context at some the region is also the area that we need to push a lot. So let me bring you a little bit about the background in Cambodia. So the way that we try to influence in context here, we try to use like the evidence-based advocacy or platform that we make sure that we have evidence to show the policy maker or decision maker they can invest in that. So the way that WaterAid in Cambodia operate with our government and non-government sector actor at the national and sub-national level, we have a working together with the private consultant and also local authority to do the scoping study that we want to mapping what is the water availability and also the geography based like there are some challenging environment, what is the appropriate technology and who are the key players that who are in operating in target area. And then when we did the scoping study, we as a whole province in Kampong Chhnang, and then we made we call the commune scheme that we map as a roadmap for each commune, easy for the local authority to understand clearly about their context, that how many people that have access to water and how many water operator or business local operator that are working there, and what is the possibility that they can operate the pipe connection or bottled water or hand pump construction, and also thinking about who are the marginalized in that area and what is the appropriate technology that they can access. So it is the all information that we create in one paper that community can easy to read and understanding about the possible to invest in that. And then to build up on that study, we working with our local authority also to do the cost life cycle costing analysis that we can bring the result from the scoping study and to work with the provincial governor and also district governor who are the make the plan as a district-wide or provincial-wide open education commitment, and then they can use that data to inform, review and update their government investment plan and also the development plan that linking about the cost for operation, cost for civil delivery and cost for coordination and some also for monitoring and quality checking. So it is a part that way that we do it. And also we not just only working through the local authority, but we bring that practice and also the result to share with other development partner like the World Bank and also the Ministry of Rural Development and Ministry of Industrial, Scientific and Technology, who are the postman ministry that lead to try the water sector in Cambodia that make the universal access based on their commitment. So that's why when we said about the methodology and process to do it, we could see that some investor like the 3i that from the Australia under the funding of DFAD and also the World Bank, they could see that methodology and then they scale to do the provincial-wide investment plan that they can bring out that methodology to map out as a whole province and then make sure the government they can invest more the financial on that. And like the Hannah mentioned about diagram of influencing platform, we use different way of influencing to push the sector. And at the national level, we also engage and working cooperatively closely with the UNICEF and also the Ministry of Rural Development to register and be a part of the sanitation and water for all is the international platform. And when the government in Cambodia become to the official member of that platform, and then they share the 4 main commitment. the WaSH financing is the one commitment that government in Cambodia need to increase the investment. Like now we could see they are working very hard and actively in preparation for the finance minister meeting that will be conducted in December. So back to in terms of the way that we do different approach at different level of influencing an organization, but for now we could see some progressing, like some commune and local district, they increase the number and also percentage of their government budget for WaSH service delivery. For example, like we can pick up the one commune in Pongro in district in the district in Kampong Chnang. They invest $1 million of Khmer Riel that for promoting the WaSH service, especially they allocate for supporting to the most marginalized people or last month that nearly close to declare open defecation free. So it is the one example that we can bring. Yes, thank you.
Great. Thank you very much. I think that that's a really interesting example from Cambodia about how you're trying to make sure that there's government leadership and using that strengthened leadership of government to make sure that other stakeholders can channel their support in a structured way, which I think really is, a fantastic example of strengthening systems and using some of the platforms that are available to us, such as the SWA platforms in the countries that bring together various actors and allow for better coordination. So thank you for that. Great. We would be good to hear now about what we are doing in the program to ensure that WaSH is inclusive, is empowering communities and advancing the right to WaSH. So let me ask Sohail from Pakistan. Sorry, I have such fantastic panelists. I'm now trying to see who might be best to answer this question. So Sohail, how have you addressed the issues of inclusion, empowerment, and human rights as part of your work in Pakistan on this program?
Thank you, Shilufia. I'll quote a little bit about the context where we work in Pakistan. Pakistan generally is a very conservative country, especially when you talk about rural settings. And it's really kind of hard to promote rights, especially women rights, in a hardcore way. So, I mean, you have to find a way to kind of contextualize your messaging. In Pakistan, you have to, well, a civil society has to work in an area. You need to get a no objection certificate or a certificate from the government, and you need to submit your plans. And like wording like empowerment, accountability, safe menstrual hygiene management are something which they are very allergic to. So when you read these kind of words, they will ask you to explain it. So I mean, that's the context you're working in Pakistan. But at the community level, we have been working with some organizations who have this capacity to mobilize women within the organization. So all our project activities have participation of women in terms of at the implementation level. But I would say it's only to the participation level or involvement level. Like I would not say we have a long way to go before women are involved in decision-making process. So that's the approach. Like we call it a incremental approach. So we start with very soft things. We contextualize things, and we do messaging which is not kind of very upfront or kind of something within the comment or within the communities. We also involve men in that process. So the area where this particular project is being implemented is socially a little bit comparatively more aware than other parts of the country. So we have women organization, there is very active involvement of women. Then on the government side, like we involved the curriculum department, and we try to kind of integrate menstrual hygiene management into school. This was something which we were working before this project came in. So that's the area we specialized in, and nobody else like can develop messaging around menstrual hygiene management. So we started with schools and gradually moved into community as well. So we take very careful, very conscious, very incremental approach to do that. We don't work in a confrontational manner because we feel if you do women rights and right-based discussion upfront, that instead of bringing advantage to the community, restricts things and kind of puts extra pressure on communities you are working with, as well as like it creates an unpleasant environment with the government. So as WaterAid, we take very careful approach, since system strengthening is meant to work very closely with the government. So we are very alive to that. So that's the approach we follow to do things. But we have not given up. We are integrating where we see the opportunity, but not in a hardcore way, in a very soft manner and in a gradual way. Thank you.
All right, thank you for that. Are you able to maybe give us some example in half a minute of any achievements you've seen as a result of that work?
I think this work on integrating menstrual hygiene management into teacher training curriculum, like we started with one district where we trained, I think, around 20 master trainers from education, and feeling the need, like government requested us to develop manuals for them. And now the provincial government has approved that particular manual to be taught in the entire Sindh province. Sindh has about 29 districts. We are only working in one through these projects. So that is something we feel will make a larger impact. Another example is that they have a school wash monitoring system, and we identified that they don't have particular indicator related to gender friendliness, functionality of WASH for monitoring their school activities. And we were successfully integrated those. They have collected data in the entire province against those indicators, and our report is being compiled, which will kind of give a very clear picture how the school WASH situation looks like, and will help the government in planning in a better way and
Great.
resourcing it in a much better way. Thank you.
Sure, thank you. I mean, thank you for giving us that example, that even in contexts where it might be slightly challenging to talk about, empowerment and human rights, we still can use the spaces available to us to highlight the challenges for women and try and other marginalized groups to make sure that we can enable access to WASH for all. All right, no, that's a really good example. Thank you for sharing that. So please let me just remind that if you have questions as we go, anything that has been discussed so far or you want to hear more about or is unclear, place it in the Q&A side of the chat. So you will see at the bottom there's a Q&A and then there's a chat, because in the Q&A it's possible for others to like your questions so that we can see them quickly. Yeah, so let me just ask this final question to Segwereda in Ethiopia. So in Ethiopia, I know that you have been working in the Oromia region where coverage is very low. Can you share with us any reaction you got from the government when you told them that you were not going to be only looking at providing services, but also supporting the strengthening of systems?
Thank you, Chulufia. I think it's a very good question, especially if you work in a district where coverage is very low and there is a pressure on the district government to deliver water supply and sanitation. So the aim and the benefits of working in addition on system strengthening might not be obvious at first, but the reaction was not negative at the start, but more pressure were on focusing on service delivery was of course on the team in the ground. But I think the key thing is to have a good link between what you are doing in the ground by delivering services with a very good and strong system strengthening approach, making sure that all processes are coming from our bottom up, and the district government are part of all processes. We just don't, as a private sector, go and deliver and go out, but they are part of all the processes and part of even delivering. So taking even part in terms of design, monitoring, constructions, and so forth, in addition to all the building blocks that Hannah was talking about. So the support, yes, the government priorities is geared to service delivery, but I think it's possible to convince the district government, and in the long term there's some results, and they see the benefits of having a better capacity, even in them accessing other services, other funding and resources at the different levels and from other NGOs. So I think there's yes, there's some conflict, but I think we managed to convince the local government to build on that area.
Great, thank you. I think that what I hear you reminding us, Segurida, is that the work of strengthening systems should not be overtaken by actors like us who try and do everything for the government, but rather work alongside to ensure we understand where the areas of weakness and what are some of the points that need to be better, whether it's understanding,
yes, exactly.
Yeah, what data we have or what financing or how we bring that in. Thank you. Now, that really is helpful. We have Maria from the H&M Foundation. Good morning, Maria.
Good morning.
How are you?
Good afternoon. Good, thank you. How are you?
I'm very well. I'm in Lusaka, so it's morning for me too.
Yeah.
Yeah. So we have a question for you in the Q&A box. So I think, and this must be Soveta, if I read the name correctly. So they are, first of all, recognizing that the H&M Foundation is a generous donor, that you offer really flexible way of working around that enables this kind of work to be done, and that organizations like WaterAid that are really interested in supporting system strengthening can collaborate with you, with the H&M Foundation, to do this scale of work across several countries. And so the question that they're asking is whether you think there's a role for other donors in supporting in such flexible ways, but also how you think this helps in achieving the SDGs more generally, supporting in this way.
Sure, thank you, Chilufia. Well, I mean, working in this way is so important because social challenges don't exist in silos. They do exist in complex systems, and the solutions therefore need to be holistic and go beyond silos in order to address the systemic change that needs to happen. And system strengthening work addresses the core of a problem rather than the symptoms, which is really the only way, I say, to create long-term positive change. And especially in order to ensure inclusion of the most marginalized. So instead of directing a siloed intervention to solve a development challenge, you need to take a holistic approach in the ecosystems where the target group exists and ensure that the most marginalized are heard and included. And I like to, silo busting, as I like to call it, is really key to achieving the SDGs. And these 17 quite different goals are so interconnected. There are synergies between each of them, and silos tend to work against synergies and suppress the multiplier effects that action in one area can have on other areas. And in the concrete case of SusWASH, what it literally means that we as a donor, and we want to ensure that our investments will not be flushed down the drain. Because if you don't have functioning institutions and duty bearers that take responsibility for operation and maintenance of services, or, well, for that matter, if you don't have an awareness of your rights as a citizen, that expensive infrastructure will eventually break down and be abandoned. And so there's no sustainability in that. And I think that's what all donors want, really. And SusWASH goes hand in hand with the H&M Foundation's vision to be a catalyst for change rather than a sort of old-fashioned donor, and to make sure that we fund sustainable projects that really make a lasting difference for people. And I always say WaterAid are such an innovative and ambitious organization in your aim to create sustainable systemic change. And we as a donor are really thrilled to be able to support that mindset. And well, for the SDGs, I would really say that if we want to reach the 2030 agenda, we need to stop looking for good old best practice, which used to be very siloed, and instead work in ecosystems to invent next practice together.
Fantastic, thank you. So silo busting, I'm taking that away for today and for this week, and to think about exactly how do we make sure that we are silo busting in addressing the systematic, challenges to accessing WASH. But do you think that there might also be challenges in funding this kind of work?
Oh, absolutely. It's very difficult to have roadmaps when you're working towards systems change. There are no roadmaps where we're going, and we're building them basically. And this is, of course, a huge challenge that we have to, admit and be humble before. And if I were to reflect from a donor perspective, I'd like to highlight some learnings from SusWASH and from the report that are important for when working towards systems change. And the first is adaptive management and learning that the report talks about. And this is central to working with systems change, but it's also something that many donors have been hesitant to fund so far. But I'd say it really isn't that complicated. It does require flexibility within planning and reporting frameworks, as the whole idea is that it's not going to be possible to foresee the exact plan going forward. It's also a slow game. Systems change takes time and won't show results within just a couple of years. And this is something a donor has to understand and accept and commit themselves to. Here it is useful to combine the systems change work, which is the long term, and combine it with necessary hands-on provision of immediate needs. These tangible activities are easier to see, to grasp, and I think that can boost morale within the teams and with everybody involved to see some concrete results within a shorter time frame while you're working towards the more longer systemic change. And it's also so important to have built up a relationship of transparency and trust. Here, the donor has to be comfortable with the relative slow pace, and the implementing partner has to be comfortable with reporting on learnings and failures to the donor without worrying about negative consequences. Systems change work needs to accept failures on the road and instead see these as lessons learned and realize that they help shape a successful way forward. So trust is paramount, and it's important that the donor chooses partners they can trust. Doing a thorough due diligence is therefore important and something I very much recommend, as well as building up a relationship where the grantee understands the importance of transparency and feels comfortable in sharing challenges and failures. And so the donor has to make it clear it's committed to the partnership, as long as transparency is there, of course. I'd say then investing in a transparent relationship is really key.
Great, thank you. I think you raised this point around mutual accountability there in really eloquent ways, between donors and implementing partners. It's also this thing we want to see in the countries between any development actors, communities, and the government to make sure we can get to WASH. I think that your point about there being no roadmaps and the need for flexibility really takes us into a question that someone has raised in the chat here. They're anonymous, but they're asking about evidence, the role of evidence in ensuring success of this type of sector strengthening, system strengthening work. I don't know who of our panelists might be happy to take this idea that, you know, if there are no roadmaps, we're being very flexible, some things take time. You know, how do we make sure that the evidence we're generating can really help us to drive the success that is needed? Anybody that would like to take this? Maybe Cesar or Segoreda?
Hi, Chipia, can I go? Cesar here.
Yeah, sure.
Yeah, Cesar here. Can you hear me? Okay.
Yes, thank you.
Yeah, so the use of evidence is very critical in system strengthening because we want to ensure that government makes policy decisions that are informed by data and also that are tested everywhere, or there's evidence that they work. So in one of the things we've done in Uganda around washing healthcare facilities, we've been able to also collaborate with others to ensure that the evidence that we generate can be collaborated, but also ensure that it will be taken up by government. So we've worked with the academia, but also line ministries to generate this evidence. And we are increasingly seeing that there's more policy discourse around washing healthcare facilities, and also government coming up to ensure that even during the period of COVID, that our evidence is used to inform government action. So one of the things we've seen in this financial year, the Permanent Secretary for Ministry of Health has directed all district local governments to ensure that at least 30% of the non-wage funds is directed to infection prevention and control. And that conversation started way back last year when we launched our washing healthcare facility study at the Parliament of Uganda, and the Speaker and all political heads at different levels have picked up this conversation. And it helps in the discussion for WASH system strengthening, because we don't want to have WASH discussed in isolation, but you want to link it with the other sectors of development, and health and education, as well as gender, are one of them. And using evidence has helped us in that area. Thank you very much.
Great, thank you, Cesar. That's really helpful. I don't know if anyone wants to jump in on this evidence one before I move to the next question. Feel free to take the mic, my panelists, if anyone wants to jump in on the evidence question. No, okay, thanks. So while Maria was speaking, I was thinking about this question that someone has asked, I think it's Fraser, about the role of champions or influential figures in achieving systemic change for WASH. I think, as cited by Soveta, H&M has been a champion, in funding this work in this way. But maybe we should hear about champions in the countries as we try and deliver this work. I think Sohel spoke about using champions earlier. I wonder whether you want to add on to that with some practical examples of what you've been able to achieve with champions.
Yes, I'll take this up. Actually, we are currently under this project, we are working with two government departments. One is Education Department, another one is Public Health Engineering Department. So, and then our approach is like we support both of them in generating evidence, creating something based on which they can improve their planning. Unluckily, within the Public Health Engineering Department, there is a lot of leadership change over 2-3 years. So we could not manage to focus on somebody who could facilitate the process. unlike PhD, we found somebody in education department who heads the curriculum wing. And like this lady actually wanted to do something for the girls' education. And when we explained our project to them, she said, okay, that matches very well into our vision. We want to improve schools. We want to improve WaSH within school. We want to create model schools. So for the last 3 years, she has been pivot in facilitating the entire process within the government. It's really hard to touch government system unless you are part of the government. So when we compare both these departments, how much we have achieved while working with this particular lady in education department, and how much we have to replan in PhD because we don't have any specific person to kind of accompany us on that journey. So we feel that the champions play a very pivotal role. They facilitate the process. They know inside of the system, so they exactly know where to kind of target your things on. So I think that's very, very key. I think probably we would not have achieved 2 key successes without that person being part of the project. Thank you.
Great, thank you very much. So the idea of working with champions and to make sure that we can maximize the gains that we, as much as we can, is so that we can reach the most marginalized. And there's a question here for other panelists to reflect on exactly how do you see system strengthening helping us reach the most marginalized with WaSH. I wonder whether I could ask Sokang from Cambodia to reflect on this.
Yes, and thank you again, and thank you everybody. And so I think when we working around the system, we consider about the people and system. So everyone is in the system, and especially the most marginalized people is the core group that we need to put in our heart of the program design. However, not just only in Cambodia context, but in some region is also the same. And when we looking back to the SDG commitment, the last mile is the one that we need to pull out and collective action that can promote to do it. And the way that WaterAid in Cambodia try to do, we are really not really the champion on that, but we try to make as the one example that can everyone take to the scale. And the way that we try to listen and hear the voice of the most marginalized people, we create the storytelling that we can working with the most marginalized group or representative, and then we can build their capacity to listen their barrier and to identify what is the marginalized mean and what is type of the marginalization or barrier to access to the WaSH. And then we bring that story to share to the public through a new platform like the public forum, that we can bring the real example for those who are, we produce a story to share to the public, and also that can engage the exchange visit that bring the high level person to meet individual with the most marginalized people to conversation and listen to the story, and also work through the social media and media engagement that they can produce the story through the live talk show and also radio or some TV program that can inspire and promote more voice of the most marginalized people to the public. And especially during the COVID pandemic, is the one example that we can work a lot with the non-formal, we call like the factory worker or some government worker, that it is the some of group that really had to reach during the challenging time, and then our teams try to capture their story and produce and share to the public. So what is that we can work together for in the future if we can reach out to everyone, everywhere, or make sure we can access or reach to the last mile. We need to make sure the promoting the sector leadership and also the high level political commitment that they can put that group is the core or the heart of the investment in the planning or in the design, that we can build the capacity of most marginalized people themselves to raise their voice more, and also create the platform or opportunity that can provide a space for meaningful or participatory that can give them the floor to engage in decision design, the program monitoring and decision making. So it is the one that we should be consider, like our team already some panel mentioned about. We should be make sure the system that can create the collective action and promote the people to invest on the most marginalized people, especially they can identify who are the most marginalized group and what type of the barrier or challenging that they face, and where is the challenging environment for them to do. And then the information or evidence from that inform them to have a clear target plan or clear strategy or way of working that can support and facilitate to address that issue. Yes, thank you.
Great, thank you very much. So thanks for sharing your approach to storytelling. And I think storytelling can be very powerful, a powerful way of showing how improving monitoring can ensure that people with disabilities are better targeted, with the services they need. I think when we talk about system strengthening, it does feel abstract for some people. Sometimes we can't easily see the connections between that work we are doing, supporting financing plans, creating champions, to actually what happens to people. So I think that that's a really good example of how those stories can demonstrate what happens for women when we are able to better analyze and understand how a plan could include menstrual health management or keeping girls in school or another aspects around women. Thank you for that. So the one question I think I'm going to direct to Hannah has been asked by, oh, did I lose it? Sorry, because of upvoting, questions go up the list. So Hannah, I think this comes from the poll. How does WaterAid's approach to system strengthening compare with that of other organizations such as IRC or UNICEF? This is a question from Richard Carter.
Great, thanks Tulufia, and thanks Richard for the question. I'd say there's similarities with our kind of framing of system strengthening and how we're working to the organisations that you mentioned, such as IRC and UNICEF, and obviously as a member of Agenda for Change, WaterAid and IRC and Water for People and many other members of Agenda for Change have come up with a framing or a conceptualization of different components or building blocks of the WASH system. So there's very many similarities, and I guess it's a case of different organizations cutting the WASH system in different ways, chopping it into different components. So UNICEF will talk about the enabling factors or the enabling environment, and their framing has multiple levels within it, whereas ours just has, those core building blocks that I shared earlier on in the presentation. I suppose the system strengthening historically has come from a place of needing to address issues of sustainability, understandably, given the crisis that there is, particularly in rural water supply and also sanitation and hygiene behaviours. I think for WaterAid, we'd say that our system strengthening way of working obviously is very focused on focusing on sustainability, but also very much people-centered and tackling the systemic inequalities that prevent people from accessing or having access to quality WASH as well. So it's a way of we see it as a way of tackling the multitude of challenges from sustainability and persistent inequalities and reaching scale. And yeah, so we really try to embed issues of gender equality, social inclusion, and break down those structural inequalities through this way of working, in addition to tackling sustainability challenges. So that's what I'd say. Thanks.
Thanks, Hannah. We have questions related to partnerships. So one is from Cipriano and another from JJ Rose. I think it's a two-part question, actually. The one is, how does WaterAid select its partners, for this kind of work? So how have you selected the partners that you're working with in SusWASH? And the other is, how is WaterAid ensuring through the SusWASH program that other actors are brought on board at national, at district level, civil society actors and others? How are we building that participation of others? Who would like to take this? Can I look at maybe Caesar and anyone else that wants to jump in after Caesar?
Yeah, thank you very much, Clea. First of all, when we are selecting the partners, we look at the value addition the partner is bringing to the program. And I can go back to the earlier question around strengthening equity and inclusion. So we look at how do we bring on board a partner that will add value in an area where perhaps our capacities are low. In this case, for instance, we've worked with disabled organizations. We've also worked with budget advocacy organizations that are involved in social accountability. So we do the mapping and we see the capacities and potential of those partners and be able to bring them on board. And we usually do that during the inception discussions, and we also do quarterly reviews where we identify opportunities that new partners can add to our work. Yeah, I don't know if that's enough, but in Uganda, that's what we've done.
All right, thank you. Thank you, Caesar, for that example from Uganda. Sohail, might you be able to share some experience from Pakistan on partnership?
Yes, I think primarily when you are working on system strengthening, there are automatic partners which are relevant government department. So you have to work very closely with them. In our case, we are working in district, and there is a coordination forum at district level as well, which is government notified coordination committee where everybody sits. So it's a combination of various government departments, like public health, engineering, education, health. So they sit together, they review plans, they kind of hold discussions around that, and the plans are shared there to avoid kind of to ensure that they have coordinated planning and they avoid duplication of resources. In terms of civil society, for the component which you are doing with the community, we have civil society partners, and for that we have a particular criteria. As Caesar mentioned, we see how their expertise are, what their technical capacities is, how they can take up certain things, like mostly it's social mobilization, the technical capacity on delivering WASH, community mobilization skills. So all that is a part of the criteria for selecting that partner. But the partnership with the government is very, very automatic. It's 2 or 3 departments: local government, public health engineering department, health, and social welfare department, who manage the activities of civil society organization within that particular area. Thank you.
Right. Yeah, this is incredibly inspiring examples I'm hearing here about all the work that we are doing in SusWASH, and the value of it is that it's happening across several countries, 4 countries that we have here, and are able to have these discussions and share the experiences that we have, that all enriches the quality of the programs, the quality of the outcomes for the people that we are doing this work for and with. All right, so this is incredibly exciting, and I want to turn back to Maria. So Maria, given everything you know about the program and listening to the discussion this morning, the questions raised by participants, I wonder how does this make you feel coming from H&M Foundation and supporting this work?
Thank you. Well, yes, it makes me very hopeful. And I would really sort of want to encourage other donors to join us in this type of work. I'd like to just mention that, well, we as the H&M Foundation have a long-standing partnership with WaterAid, and our relationship works so well because we're like-minded, and we're joined in our deep conviction that it's not enough to focus on taps and toilets. And in order to ensure inclusive and sustainable wash services, you need to look at the systems behind service provision and make sure that they're functional or even exist. And we have that transparent relationship built around trust that I was speaking about earlier, which allows for that journey out into uncharted territory without the roadmaps. And for donors then who are thinking of funding systems change, I would really like to just say, go ahead. The time to act is now. As we're all aware, we are in the decade of action now, and the urgency tells us that it's time to find new ways of accelerating change and the change needed to reach the SDGs by 2030. Funding systems change requires a different mindset, and that's really all there is to it. We have realized that we, as a donor, need to use our role better towards catalyzing systems change on a broad scale. We can't continue asking partners for siloed interventions because, well, as I said, social challenges don't exist in silos, but in very interconnected systems. And systems change is too complex as well for any actor to tackle alone and requires broad cross-sector collaborations. And we as donors can really shift the needle, enable holistic systems change and those broad collaborations, if we ask for that and are willing to fund that. So I'd say donors can and should allow themselves to be innovative and try new approaches, but also dare to take on that more long-term perspective. And all of this will be needed to fast-track change. Because, well, let's face it, I mean, systems change is complex. It will not show quick results. It's not easy to measure. But we believe that in the long run, this will prove itself to be the most cost-efficient and impactful approach to improving lives and our best bet to reach the 2030 goals. So donors need to dare to do things differently and invest early in systems change. And I say we need to step up now. Thank you.
Great, thank you very much, Maria. I like the word you used to describe how you feel, hopeful. I really like that. I feel hopeful with you that all of this work is achieving the results that we are seeing. But also thank you for reflecting on what other donors should be thinking about in this time, you know, strengthening systems, how we make sure that we are ready, even when shocks like COVID find us, we will be thinking about, you know, we will have resilient wash service delivery systems in the countries that can withstand, or at least can measure up to the challenges that face us if we strengthen the systems. Thank you. Really inspiring. So those were our final reflections from Maria. I just want to check whether you have any more final reflections, because our chat has a nice picture of you here, and I want to make sure that you have aired any final reflections.
Thank you, Chiluvia. No, I think that's all I had to say now. Thanks.
Sure. Thank you very much. Okay, so we are getting very close to the end of our 90 minutes together. And it's been a really inspiring discussion, for me anyway. Listening to our colleagues from Cambodia, Pakistan, Uganda, and Ethiopia, sharing the various things that they've been able to achieve, the various challenges that they have faced, but the commitment that they have kept on to make sure that we are working in this way, strengthening systems, strengthening partnerships, focusing on the most marginalized, all of it essential for achieving SDG 6, as Maria just reminded us. So let me just go to our takeaway messages for today. And all of them, I have to say, have been very eloquently summarized by Maria and other speakers. But just to remind you that what we are talking about here, our work of system strengthening takes a long time. And I think there was the reference to trust and transparency being quite at the heart of ensuring that we work together in a consistent and long-term way. But that trust and transparency for me shows a long-term commitment to ensuring that we support WASH actors and that WASH actors are equipped to work with governments in ways that bring about the long-term change that we're trying to see. The second takeaway message is that budgets need to be flexible, and so does our outlook. So I think that was the point, again, made by Maria about there being no roadmaps. And that requires that we can be flexible, we can adapt, we are learning continuously and having opportunity, like we have this morning, to sort of share the outcome of what we are learning up to this point, hear from others, and improve the work overall. The third is about resources and capacity for analysis, learning and adaptive management, that these have to be available continuously, that there has to be initial analysis, but ongoing look at what do we need to do system strengthening work properly? How much do we need to add in as we go? And then lastly, that the greater cost effectiveness or catalytic impact for lasting inclusive WASH at scale is what we expect to see from all of this work. We think that working only to provide services resolves the problem for a very limited number of people that any program can reach. But working in this way, strengthening systems, allows for national level ability to reach people everywhere. And WaterAid often talks about getting universal access to WASH for everyone, everywhere. And that's why we strongly believe that supporting the strengthening of systems enables us to catalyze that impact on a larger scale than investing only in providing services to the people that we identify in small pockets in our countries. All right, so at this point, I'm really grateful that more than 60 people have stayed with us throughout the webinar, and hopefully that you have had a good time listening and understanding. Various people are available to answer any further questions that you have or engage on this. A special thanks to Maria, representing the H&M Foundation, for the work that you have done. Special thanks to our panelists, Segwareda, Sokhang, Sohel, and Caesar, representing the work in your various countries and showing what it takes to do this kind of work, and that commitment and perseverance can really take us there. Hannah, for coordinating this, and other colleagues in WaterAid that I won't mention, the list might be long, for making available various kinds of resources, some of which you see on the screen right now, blogs, the reports that we are launching today through this webinar that you can access on our WASH Matters page that is on the screen. So I started off boasting that I am well known for facilitating everything within time. And we are 2 minutes to the end of our scheduled 90 minutes. So I'm very proud that I've lived up to my good reputation. So let's leave it here. And I remind you that we'll use the last 2 minutes to fill in our survey that we introduced at the beginning. So we have a post-event survey that won't take you more than 2 minutes to fill in. So please, we encourage you to do that. So thank you very much. Do have a good day or good evening, depending on where you are. And that's the end of our time together this morning. Thank you.